According to the United Nations Children's Fund, UNICEF, there were about 590,000 young people between the ages of 15 to 24 who were newly infected with HIV in 2017 alone. Among these, 250,000 were adolescents aged 15 and 19 years. Hello and welcome to another episode of The Last Mile with NACA. I am Adesuwa Osui. In Nigeria, adolescents and young people make up a significant segment of the population that is particularly vulnerable to HIV, making them a priority group. You are watching The Last Mile with NACA. Don't go away.
Adolescence and young adulthood is a period of intense physical and developmental transition that is characterized by experimentation and self-discovery. This time period may pose unique challenges for the prevention and treatment of HIV. Today, adolescents and young people represent a growing share of people living with HIV worldwide. In 2020 alone, 410,000 young people between the ages of 10 to 24 were newly infected with HIV, of whom 150,000 were adolescents between the ages of 10 and 19.
When we talk about adolescents, these are people that are 10 to 19 years old. We know that they go through a lot of changes at that time. Puberty and what have you. At some point they're like children. At another point people expect them to take decisions almost like adults. So they are not actually children and they are not yet fully formed adults. But they want to behave like adults. So it's a trying time for the adolescents and for their caregivers. Young persons are defined as those between the ages of 15 years and 24 years. So when you say adolescents and young persons, you're looking at 10 years to 24 years. So the main reason why we're interested in this age group is because of the adventurous nature, risk-taking nature, and then the data. Our data has shown that they are major drivers of the epidemic.
In Nigeria, for instance, in 2020, about 6,500, roughly 6,500 new infections happened in that age group that is 10 to 19, just that age group. And when you look at the whole new infections in Nigeria, it's about 60,000. But that age group alone accounts for 1/10 of the new infections, and that's what the storyline is, even globally. About 1/10 of the infections in young people is in Nigeria. So if you have 100 young people from all over the world that are HIV infected, 10 of them will be Nigerians. So it's a dire picture, and all hands are on deck, I must say, under the leadership of NACA and other organizations.
The Association of Positive Youths in Nigeria, APIN, is a body that facilitates the prevention, treatment, care and support for adolescents and young people in the country.
Over the years, it has evolved to being one of the key major stakeholders at the forefront of HIV response for the country in terms of issues of adolescents. And again, as an institution, we have spread across the country because APIN have state chapters across the 36 states plus FCT, which is headed by coordinators. So our response at the state level are also driven by our actors at the state level in partnership with the SACAs, just as we at the national level partner with NACA.
The National Agency for the Control of AIDS, NACA, being a coordinating body, provides the enabling environment for programming, policies and guidelines for adolescents and young people.
We are coming out with specific guidelines for adolescent and young people's programming. We started with the National Adolescents and Young Persons Strategy. There are also some other documents from Federal Ministry of Health for adolescent health. Anything that is done globally, any new any new concept that comes out globally, at NACA, we try to look at it, try to domesticate, and see how we ensure that the adolescents and young people are not left behind. One of such is the issue of mental health and people living with disabilities. That somehow they tend to be left behind. But NACA is saying, just like it is being said globally, that no one should be left behind. So we have to make the extra effort. Right now, we are encouraging studies that are specifically for adolescents and young people. So what are they doing? They want to find out, what do young people do? Where do they hang out? What we call the hot spots, where they take some of these risks that we're talking about. Because if you don't have that kind of information in each state, you can't program properly for them.
The agency collaborates with relevant stakeholders on various programs for adolescents and young people.
We do a lot of work with NACA because NACA is the lead agency for the HIV response in Nigeria. They are the ones that coordinate the multi-sectoral response. Of course, the Ministry of Health is also very important because a lot of the interventions for HIV is in the health sector. But we know that HIV is more than a health problem. That's why it's very important that NACA is on board to help coordinate the partnerships. So we work with NACA to help in the coordination of partnerships. There's a technical working group for prevention, which UNICEF works on. And when you say prevention, it's prevention in everybody, the general population, but also we have a subcommittee that focuses especially on young people, adolescents and young people, because they're a special group that you must focus on. So working with NACA, we do all that. We also try to ensure that we have data systems for tracking what is happening, because whatever you do, if you don't have good records, then it's not happening. Nobody knows what you're doing. So we need to keep good records. Working with NACA, working with the Federal Ministry of Health, we have the health sector and the non-health sector data.
NACA have been instrumental because NACA actually supported APIN, I remember 2016, to pilot what we call Lock the Virus. So Lock the Virus was a project whereby adolescent girls and young women were empowered with knowledge and were deployed to engage their peers at the society, at the community, sensitizing them about HIV and also getting them to go for testing. So, and psychosocial support will also follow up. And we have done series of condom outreach with support from NACA and also AHF. And we are also hoping to do more. I really appreciate the fact that at the moment we are currently working with NACA, and we just started what we call Adolescent Kids for Expression, which is supported by UNICEF as well, across 7 states, Rivers, Lagos, Cross River, Enugu, Kaduna, Benue, and FCT. So, and actually that intervention is a model that is designed to strengthen community structures of APIN and its PLHIV members, and empowering young people as community facilitators to continue to engage other adolescents through support group platform.
Young women and adolescent girls in particular account for a disproportionate number of new HIV infections.
Girls are at risk, more vulnerable than the boys. When you look at number of new infections that happen, I said it's about 6,500. Almost 5,000 of that is in girls. So 76%, over 70% of the new infections in young people are in girls. So for every one young boy that is infected, 3 are infected. So their vulnerabilities are very high. So when working with NACA, we have programs and packages of interventions that have been developed, to address this vulnerability of young girls, adolescents and young women, the age group 15 to 24. They are at higher risk. One, because that age of 15 is the age where they start becoming sexually active. There's a lot of child marriage, there's a lot of sexual abuse, there's teenage pregnancy, they are not going to school. If in a and the burden of poverty is really rests on the girl. She bears the burden of taking care of her siblings. If for any reason anybody has to drop out of school, after school, it will be the girl. If for any reason anybody, any of the children need to go and walk outside, it will be the girl. So the girl is vulnerable and at risk.
There are a number of factors that increase HIV vulnerability among young people, including limited access to youth-friendly services and stigma.
According to the law of Nigeria, it's when you hit the age of 18 years that you are considered a mature person to take certain decisions. Even to get your driver's license, you must be 18 years. Okay? So in the same way, services, particularly like reproductive health services, HIV prevention services, like condoms, and are not things that adolescents in particular can just walk to a clinic and ask for. Usually, the health staff will want to be careful. They'll say, do your parents know you are here? Do you have their consent to take up these services? So that has made it very difficult for them to access services.
We are dealing with two forms of stigma. One is coming from the self and one is coming from the society. So, and the fear of sharing or coming out to report some of those cases when stigmatized. So, no matter how you want to address stigma, if a person that is stigmatized does not open up for the law to take it due course, a lot of young people will be afraid of speaking up. And the more we have more mouth closed, the more stigma increases. And again, like I told you, we have the self. The self is the toughest. When you don't conquer it, no matter how people or no matter how the government want to go about it, it will not get done.
The fight to curb increasing new HIV infections among young people is a collective one.
The young people now are going through a lot of mental challenges, physiological, environmental, societal, all sorts of issues and challenges coming from different angles. They are all unleashed on these young people. Therefore, young people are actually under a lot of siege. So we need to support them to traverse this time they're having difficulties with. And we should not look at them as a problem. We should start to look at young people with a different lens. They are a solution. They are the strength of the nation. They have a lot of resources. They are a human resource, especially the girls. So let's change the narrative and empower them.
Young people should avail themselves of whatever platforms, social media, information is out there everywhere. They should avail themselves of that information. And NACA has the hotline 6222 that people can call toll free on certain, I think 9 mobile, MTN, and so on and so forth, Airtel. For the people out there, general population, we need to understand that the internet has opened young people to a lot of information that they would not have otherwise had before now. So we must not behave like the ostrich that buries its head in the sand. Parents should take up their responsibility of telling their children the truth about life and how to prevent diseases such as HIV and AIDS.
HIV and AIDS remains a growing public health concern, and young people are the key and need to be engaged in order to stem the tide of the epidemic.
We all know festive period is a time to loosen up. We all have fun, lots of hangouts.
However, statistics show increased indiscriminate sexual activities over the holiday period.
Unfortunately, this also means more people are getting sexually transmitted infections.
One gift I will never love to get during this festive season is that of HIV infection.
So, celebrate this holiday responsibly and with caution.
Avoid anything that can lead to new infections, impacting the progress made in the fight against HIV and AIDS.
Your New Year resolution should include knowing your HIV status.
Get tested for free today.
Bruv, babe, share love and not HIV infection.
The NACA update segment is next. Keep watching.
The UN Women, in association with UNAIDS, UNESCO, National Agency for the Control of AIDS, NACA, and Association of Women Living with HIV and AIDS in Nigeria, ASHWAN, recently organized a 3-day training and advocacy workshop for women and girls living with HIV. The closing ceremony, which focused on gender-based violence, stigma, and discrimination, had several dignitaries in attendance. The opening remark was delivered by the country rep, UN Women, Comfort Lamptey.
This 3-day gender-based violence and stigma reduction training, which closes today, has sought to deepen the knowledge and understanding of the women here and their allies on sexual and gender-based violence prevention and response, stigma reduction, and also provide leadership and networking skills to all present. And it is our hope that we'll strengthen the partnership that has been established today towards the goal of ending AIDS in 2030 and ensuring that no one is left behind as we move towards 2030.
Goodwill messages were delivered by the representatives of UNAIDS, Society for Family Health, and Action Aid. The Minister for Women Affairs, Dame Pauline Tallinn, was represented by the Director, Department of Women Development, Funke Oladipo.
All hands must be on deck to rid our society of all forms of discrimination and stigma. I therefore call on all, particularly the media, to join other partners in ensuring and amplifying the crusade to declare as zero tolerance against rape, stigmatization and discrimination on HIV/AIDS survivors, especially for women and other forms of survivors of gender-based violence in Nigeria.
More goodwill messages were delivered by the Executive Secretary, National Human Rights Commission, Tony Ojukwu, and AIG of Police, Aishatu Baju Abubakar.
I can assure you that the Inspector General of Police and his management team have the entire Nigerian police have zero tolerance to issues of GBV or any form of stigmatization for whatever reasons. And as the first gender advisor, we are putting all hands on deck to ensure that all perpetrators of gender-based violence, discrimination, any form on any woman, as the first gender advisor, I can tell you, will be duly dealt with and will be brought to book.
Gender-based violence is a global pandemic which is deeply rooted in gender, social, and cultural norms which devalue women and their role in the society. Stigmatization of women and girls living with HIV and AIDS, of course, does lead to discrimination and other violations and abuse of their human rights, which affect their well-being in fundamental ways. Well, I'm here today to tell you that please, if you suffer any such thing, just take a phone and call the National Human Rights Commission. We are going to stand by you, we are going to fight for you, and we'll make sure that your rights are restored to you.
The DG, NACA, Dr. Aliu Gambo, delivered the keynote address.
HIV has affected or is affecting female greatly compared to men. And this has to do with so many things. Inequality is one of it. And because of your ability to come forward to accept and HIV testing and know your status, today we're able to identify most of you that have HIV in them and place them on treatment. So it is our responsibility to make sure that you are not discriminated against, you're not stigmatized. And I'm happy with the assurances I got today and what we have heard from the Executive Secretary, National Human Rights Commission, and most importantly, what we have heard from the representative of Inspector General of Police, the AIG Aisha Bakar. She has given us assurance that those things that we have on stigma and discrimination in the country, the law we have, this law that we're domesticating in virtually all the states in Nigeria, if they have not been working, which I believe they're working, now they will work more.
Highlight of the event was the launch of a toolkit for action in making HIV response work for women and girls, as well as the presentation of certificates to participants.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
Sister! Where you dey rush dey go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labor or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sen ten ce. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate against persons living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Ade Suwausi. Goodbye.